So my name is Saul Pressner. I'm the president of the Academy of Biomimetic Dentistry presently, and I practice biomimetic dentistry in New York City. And it's my deep pleasure to introduce Dr. Paul O'Malley, a dear friend and colleague, who will be our speaker today. We'll be speaking about efficient biomimetic applications from basic to complex cases. Thank you, Paul.
Thanks. Thank you, Saul. That's a great introduction. So, I wanted to share with you my practice and approach. I graduated in 1984 from Creighton University, and I jumped right into practice and I went to work in a clinic in West Texas. And I did a lot of immediate dentures and extractions and playing around with vertical dimensions and opening bites and closing bites. And, we were taught at that time you can never touch the vertical dimension of occlusion. And I just thought, okay, well, we're locked in. So I'd get these patients that had severely worn teeth. And of course, what do you do with them? You had to grind them all down to smithereens and place caps on them. But that's the tool we had at the time in the mid 80s. But when I would do those kind of procedures, I kept looking at, I want to do something better for my patient. That seemed just so destructive. So, with biomimetic dentistry, what are some of the key takeaways that we find with it? And by the way, today I'm not going to be getting into the deep scientific aspects due to time. I'm going to get more into the application from some simple cases or seemingly simple, but applying the principles of biomimetic dentistry. We want to do age appropriate presentation for this patient. We don't want to have the big white ones. These are the temporaries. They're a little too white, obviously, and too bulky, which will dial in with the final restoration. But they're all almost all of these dive in and seal, and the gingiva is going to be super healthy because the labs now can make all the final restorations ultra thin. And now we've covered all those areas where there's been erosion and recession to protect those root surfaces, along with biomimedically using immediate dent and sealing on those areas. So we place the upper veneers now, and we're going to be getting ready to place the lower veneers. And the way that I place the veneers, I've been doing it for a long time. Ray and I probably are very similar. I do what's called rapid cementation. So some of the dentists will do rubber dam and do a couple teeth at a time. I was trained and learned how to put them in pretty quickly, and it's much less, in my opinion, traumatic to the patient. But I think either way works based on what I see long term. And there is our handsome young man now. That's a blast to do, to not have to destroy someone's enamel to correct this bite. All the way back to when I was in West Texas and I had that farmer come in with severely worn teeth. And I just ground his teeth down to put caps on everything. We've come full circle now to being able to do this beautiful dentistry without grossly harming the teeth, which is the goal in biomimetic dentistry. And here it is after a couple of weeks of healing time. And this will last him, obviously, the rest of his life. So he's very happy and proud of that, as am I. Now we have a complex full mouth reconstruction case. And, I encourage everybody that's starting their journey in biomimetic dentistry. And I think all of us who've been doing it for a long time, we see ourselves as dental engineers. Obviously, we're connected to the patient. We want to do what's holistically correct for them, but we're building the teeth in layers and we're intimately understanding the structure of the teeth. So we're using materials where the modulus of elasticity is followed as best we can. If there's cracks, we learn how to tunnel down the cracks to take care of them. We can use rib bond and we can rebuild teeth that normally would require extraction and dental implant, or root canal and later extraction and dental implant. So this lady came in and she has a lot of erosion around her old restorations, a lot of massive, massive class fives with recession going on. Hygiene was not in good shape at all. and she had malocclusion and basically decay everywhere. So we got in and we started removing all the upper restorations, and there was severe decay around everything. In this case, everything went below the gum tissue, and I maintained that gum tissue. We double pack cord in there to keep that well isolated so we wouldn't get cellular contamination. And you can see that here there's some infected, all the infected dentin was removed and the affected dentin left in place based on the caries dye. And we had a nice 1 to 2 millimeter peripheral seal zone. This is the pre-op x-rays. If anybody was to zoom in on this, you'd see there's recurrent decay under everything, and it's deep and extensive. All the teeth were vital. And so therefore, she had been elsewhere. I think she was quoted 8 or 9 or 10 root canals and crowns on everything. And that's how she came to see me. You know, people don't want their teeth ground down. It's just they're becoming more and more aware of it, thankfully. So we did the painstaking steps of going through the immediate dentin sealing, always using air abrasion, um, and then the etch, the 3-step system. And then of course we have to wait 5 minutes, especially in these deeper areas, in these deeper dentin and root surface areas, to let this polymerize, because otherwise you're going to be putting subsequent layers on and it's going to pull from those bonds, or it has a tendency to put a lot of strain and stress on the bond. And we have the Journal of Prosthetic Dentistry. I mean, it talks about immediate dentin sealing. So, I mean, everything's taking hold, and that's all the way back in 2005. And we know by doing IDS that we're going to increase our bond strength by up to 400% compared to just bonding something right onto dentin at the same time by doing this protocol. Also, we have the concept what's called decoupling with time, and that is basically there's a hierarchy of bondability. So, you know, people that are on this webinar, one of the big paradigm shifts is we all, if traditional dentists who say what has the strongest bond strength, enamel or dentin, everybody's hand will go up. Oh, we know that it's enamel, but the truth is dentin is almost twice as strong as the enamel bond strength, but it's much slower. It takes longer for it to mature. So we have to honor that um, uh, biology that's present within the tooth structure itself. And we do that by bonding and by using the immediate dentin sealing, walking away, letting things polymerize for 5 minutes or more before we start putting different increments on. By the way, this is by Dave Alleman and his son Davey Alleman. It's a beautiful article on decoupling with time, and we want to follow that protocol to minimize stress and strain and improve marginal integrity. And here's the completion, and everything was raised. A shout out to you, but I use the Accolade resin luting adhesive system, which I love. One of the best out there, because the try and paste you can do, which mimics the color of the final adhesive material. And we see on the top, that was the obviously before we started, after, and we have a happy patient here, and no root canals. And after 5 years, no root canals.